Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of gynecomastia. So, diagnosis of gynecomastia include in the diagnosis of gynecomastia, if the patient is a non-obese male patient and if the patient has breast tissue of at least 2 centimeters in diameter, then we can diagnose that patient has a male patient has a gynecomastia. Then treatment of gynecomastia. So in gynecomastia, most of the patients will resolve on their own spontaneously. No treatment may be required in most of the patients. But there are some non-surgical treatment or management which can be given for this case. Includes first, in the non-surgical management, we should correct the underlying cause, and also we should do cessation of the offending drug is important. Then then we also have pharmacological agents. In the pharmacological agents for gynecomastia, we can use anti-estrogens can be given to the patient. Anti-estrogens like containing tamoxifen or aromatase inhibitors like danazole can be given for the gynecomastia. These are the medical treatment which are given for gynecomastia. Then what about the surgical management? In the surgical management can be done, but what are the indications of surgery in gynecomastia? When do you do surgery in gynecomastia? In gynecomastia, surgery is indicated if there is gynecomastia is present for a longer duration. That is, if the gynecomastia is present for more than 1 year, or if there is continued growth. If the patient has continued growth of the breast is still seen, or if there is psychological, or if the patient has any cosmetic problem, or if there is tenderness, or due to suspected malignancy, all this will result in gynecomastia in the patient. Then we have surgical procedures. What surgical procedures can we do for gynecomastia? For gynecomastia, we can do mastectomy can be done, where we remove the whole breast along with nipple and areola complex. Subtotal mastectomy can be done. Then subcutaneous mastectomy can be done. And we can also do reduction mammoplasty can be done to the patient. And we can also do suction assisted lipectomy can be done. This will remove only the adipose tissue and thus decreases the breast size.
thank you and thank you for watching.